With our oncology population, we have a high number of patients that experience end of life here on Ward C3. What the staff will say what they struggle with is supporting themselves as well as our patients and families.
On one hand, you're very emotional having gone through what you just went through with this family and you're trying to support them. Then on the other hand, you've got to go into your other patients' rooms and be your happy self and keep them kind of in a positive mood, and that's kind of difficult.
A multidisciplinary group got together to look at ways to identify how we can support the staff on the unit.
Through our discussion, we found that some of our nurses felt guilty having to ask another nurse to kind of take on their responsibilities while they stepped away. So working off of that, we realized maybe if the break buddy it was mandatory for the break buddy to ask, then nobody would feel centered out or feel guilty. Our break buddy would approach the primary nurse and they would say, I'm sorry to hear that your patient passed away. Just wondering if you need to take a few minutes to kind of step away from the ward. I'll cover your patients and your call bells, and just let me know if you'd like to take some time.
Some of our staff want to leave for personal time. Some have a cry, some want to just feel free to leave or to go and talk to the family. But the whole purpose of that is to support the staff with self-care.
It makes it easier to go back because you've been able to focus on your feelings and kind of get yourself back into a good headspace so that you can put all your focus and attention onto the patients and their families that you have left.
It allows them to get re-energized, whether it's getting a coffee or sitting down or just pulling their thoughts together to finish the day, but also to know in coming days that they have support from their colleagues.